Alright folks, so we're going to review the quiz, MRI Basics Quiz 1. If you would be so kind, take a look at the attachment that I sent with your blank quiz in addition to the quiz results that I sent you as well. Overall, excellent job by the class as a whole in really mastering this first quiz. So let's dive into the content. Question number 1. What type of magnet is used with most MR systems currently manufactured? That would be a superconducting magnet. How do you define what is a superconducting magnet? That is a magnet that is defined by having supercooled gases in what we call cryogens, especially liquid helium, that are used to keep the windings inside the magnet supercooled at that temperature 4 Kelvin, so that we can have a constant magnetic field. Magnet is always on. We treat and respect the magnet as always being an on entity. Question number 2. Visitors and site employees entering the MR scan room with the patient should always be screened for metal in the same manner as the patient. So D, we always want to screen patients as if they're visitors with patients, as if they're patient themselves are being exposed to the magnetic field. So we're screening for ferrous objects, we're screening for implanted devices. FDA limits SAR absorption to whole body MR applications to 4 watts per kilogram for 15 minutes. Please keep in mind this is on a sequence by sequence basis. This is not on the totality of the exam as a whole. Patients with suspected intraocular metallic foreign bodies must be screened for metal prior to entering the field. This can be done by D, taking plain film x-rays of the orbits and obtaining rad clearance. Keep in mind this is the minimum method. Preferred, if the question was asked of you, would be a CT with thin cuts through the eyes or the orbits. Patients with tattooed eyeliner or other ferrous pigment eye makeup should be advised of what possible complication during the MR procedure, and that would be temporary skin irritation or swelling of the eyes or surrounding tissues. So 5 is C. How do you treat this skin irritation or swelling? Treat this with cold compress or an ice pack. Cool or cold treats a burn or heat. Question 6, which of the following primary biological effect is missile or torpedo effect in tissue tearing? Always this has to be static magnetic fields. That has to be that primary driver behind the large field strength of Tesla and the potential injury, wheelchair stretchers when flying into the magnet, and sometimes injuring people that are stuck in between the two. All the following are ferrous substances except for gold. Gold is a diamagnetic or slightly repelling substance. Platinum, silver, I have a chain on that's going to not pull in the magnet as I'm walking or exposed to or around the magnetic field. Stainless steel, iron, nickel, these are objects or types of metal that we have to screen for as a daily function of the MR technologist. Which of the following is not a magnetic field utilized in association with MR imaging? Gravitational earth magnetic fields. Which of the following has been documented to cause muscle contractions, cardiac arrhythmias, mild cutaneous sensations, and visual light flashes, or those magnetophosphines? That would be time-varying magnetic fields or gradient. So 9 would be B. Question 10, which of the following field has a primary biological effect of tissue heating or deposition? And this would be our oscillating magnetic fields or radio frequency. Use a lot of RF, creates a lot of heat in the patient. The 180-degree pulses that we'll talk about soon are 4 times the power of the 90-degree excitation pulse that tip the magnetization away from B0. So using a ton of radio frequency creates a ton of heat in your patient. 11. For screening for implants and pacemakers, we don't want any of these implanted devices, active devices, to cross or pass that 5 Gauss line threshold FDA limits. All the following are biological effects of the gradient field, or TVMF, time varying magnetic fields, except for the missile or torpedo effect. Not an impact of the gradient fields, everything else is. FDA safety levels for RF exposure during MR exam are defined by SAR restrictions, which reduce the risk of systemic or thermal injury, heat potential. That heat deposition or RF energy deposition, SAR, we don't want that deposition to increase the body temperature of more than 1 degree Celsius. That's our threshold or our limit. Especially we think of amniotic fluid or pregnant patients. We don't want to exceed that 1 degree Celsius threshold. Risk factors for MR exposure of SAR include all the following except for hypotension, low blood pressure. Not a risk factor. High blood pressure is. What element in the body is a principal nucleus utilized in MR imaging? Always hydrogen. We chase everything having to do with hydrogen, especially water and fat. From closest, we're on question 17. From closest to furthest from the patient, place the MRI coils in order: radio frequency, gradient, shim, and main magnet. These are the components from closest to the patient to furthest away. B1 is another name for the radio frequency field, always perpendicular to B0, always a smaller intensity magnetic field than B0, its larger, more powerful counterpart. So B1, radio frequency field, its function, as we learned last week, is to tip or flip the magnetization away from longitudinal, and we need that to create an energy with which to detect those signals that are emitted from the patient's tissues. In cross-sectional view of the MR machine instrumentation, which coils are closest to the patient? RF coils, always. That's what creates the most heat physically. It's closer in proximity to the patient. Don't ever have a patient position close against the sides of the magnet. Always create that separation so they're not laying almost directly against the radio frequency coils. Liquid cryogens are cooled in a superconducting magnet at a temperature of 4 Kelvin. Resistive magnets can be shut off quickest in case of emergency. During a quench of the MR system, patients and employees should be evacuated from the scan room to avoid asphyxiation, frostbite, damage to tympanic membranes. Force that an object can be attracted to the magnetic field is reliant upon 3 main components: how ferrous the nature or properties of the material, how much stainless steel or iron or whatnot, the mass of the projectile, how big it is. A paper clip is not going to fly as hard and powerful as that wheelchair that's not an MR wheelchair. And the field strength in Tesla of the MR system. A 1.5 Tesla magnet will pull an object, but not nearly with the strength and propensity as a 3 Tesla system. So a stronger field strength, stronger pull to these ferrous objects. How many fields do we use in MR imaging? 3 fields. And that would be our main magnet or static magnetic field strength. That would be our radio frequency field, and that would be our gradient fields that will complete our image. FDA has the limit of field strength in clinical use to 4 Tesla for the entire population and 8 Tesla for those over 1 month of age. Ferrous substances have strong magnetic properties and can be pulled into the magnetic field, so 26 is D. 27, magnetophosphines, I like that word, I'm going to have to spell that right, are a potential side effect of the TVMF, described as seeing stars or visual light flashes. The first level controlled mode in which, I should scroll down. The first level controlled mode in which operating parameters reach values that may cause physiological stress, 1 degree Celsius or up to 4 watts per kilogram. That's the first level controlled mode. System or manufacturers default into first level mode. If a patient with a conditional stent or cardiac pacemaker that's conditional or things of those level, we need to then change to normal mode, which is less temperature, potential increase in 2 watts per kilogram. But what's the drawback to you, the MR user? Longer scan times. So always a give and trade, a give and take with what parameters are we changing and what is it doing and what's the impact on us and the patient. 29. What is SAR, specific absorption rate? 30. What field strength is the system operating at 30,000 Gauss? That would be 3 Tesla. Why? Because it's 1 Tesla for every 10,000 Gauss. Unit of measurement, detecting field strength at isocenter, in the center of the magnet, center of the system, measured in Tesla. 31 is D. 32. Orientation of the main magnetic field in a low field permanent. Think of an open MRI, and that would be a vertical field. Completely changes how Z starts, and then X and Y would be perpendicular to it. Comprised of unpaired electrons, paramagnetic substances are positively susceptible and become magnetized when placed in an external field. They lose their magnetism once they're removed from the magnetic field. Comprised of paired electrons, the diamagnetic substances don't have any properties of magnetism, maybe a slight negative or repelling force. By the way, paramagnetic, 33, think of Gadolinium MR contrast is one of the more common examples of paramagnetic substances. We're going to touch on that soon in a few weeks. Passive shielding can be defined as steel lining in the walls of the scanner room. Active shielding is superconducting windings within the scanner bore, reducing the footprint of the fringe field. What is copper lining in the walls of the scanner room? That is a method of RF shielding, also known as the Faraday cage, the integrity of the copper lines around the walls of this MR scan room. And then what is letter C? A method of improving the homogeneity or uniformity of the field, optimized on a patient or sequence basis via robust pre-scan measurements. That's a technique called active shimming. You'll see technologists place volume boxes over the anatomy they're imaging. That's active shimming. I want to tell the system, almost collimate or concentrate your magnetic field in this particular anatomy so you have the best fat saturation, contrast, uniformity in that particular area or region. That's a method called active shimming, and that's a function that the technologist performs all day, every day. Question 37. Current FDA limits limit the patient exposure of the gradient field, also known as time-varying magnetic field, to levels at which the patient feels unbearable peripheral nerve stimulation. No set number or percentage. It's what can the patient tolerate, then that's your limit. 38. The array processor is located in the MR equipment room that reconstructs the signal data into the image. That's your Fourier transform, mathematical computations to take data from the patient and transfer it into grays and whites and blacks on our image. Patient image display with the parameter adjustment functions, that's located in the scan control room where the technologists sit and make the magic happen. The unit of measurement in the magnetic field surrounding the periphery is known as Gauss. This is again at the foot of the table in the side of the room, but not in the center of the magnet, and that's in the periphery of the MR scanner. I hope you found that quiz review to be helpful, and take a look for the next video. Thanks for watching. See you soon.